Hello, everybody. So I am Dr. Fitzmaurice, and I'm here with Ashley O'Dwyer from the Eye Guys. And so tell us a little bit about like who you are, and how your organization is kind of fitting into this Alaska rural healthcare transformation.
Yeah, my name's Ashley O'Dwyer. I am president of the Eye Guys. I purchased the company with my business partner, Oliver Godnig, about 5 years ago. And when we purchased it from his dad, and he had been running the Eye Guys with his dad for the past 20 years. So the Eye Guys have been around for a while, and we travel to all rural villages all over the state of Alaska, delivering eye care where there's not currently access.
Okay. Um, well, I mean, I personally know I've had some eye issues. So let me tell you, there's nothing more important than having a good eye doctor around when that comes about. Tell me a little bit about this whole application process and what exactly are you looking to achieve?
Yeah, yeah. So I think the grants that are out there right now are incredible for the state because we all know that Alaska has a healthcare issue. And a lot of that is due to just getting to places, just the infrastructure that other states have that Alaska doesn't. So most of the places we go to, we have to take planes to. Once we take a plane, sometimes then we have to take like a smaller bush plane or even a snowmobile or even a raft to some of these villages. And if it's hard for us to get there, I can't imagine somebody that lives there getting back out into the big city. Not only do they have to find their way back, but they're not used to going to the big city to get healthcare either. So, being able to come to these villages is invaluable to the people there just because otherwise they wouldn't do it. Not only it's just not their culture. They grew up in a place that just doesn't have the types of things we're kind of used to everywhere else. And so when you just expect them to go from that place to all of a sudden, like, here, try to find your way into Anchorage, take a plane, a jet there, and like, there's so many like logistics that when you do it a lot, you kind of take for granted. And them, it's just like a whole new world. It's like picking them and putting them like, I don't know, just completely out of their comfort zone. And then on top of it, you're trying to tell them that they need eye surgery and things like that. Like that for anybody, even if they're used to a city location, is a big deal. Like surgery's scary to people, but to just like plop them in a new spot on top of that, it's a lot. And a lot of times they don't do it, even if you like explain it really well. And telehealth is a great idea because you can kind of talk to them through a screen, but that's another layer for them too that they're really not used to. And so to be able to go into the villages, get to meet them, get to like stand one-on-one in their element and actually explain what's going on to them is really really valuable, and that's what we do. And we kind of make it a little easier face to face, telling them the steps that they have to go through to get to what they need. And we're kind of like we walk hand in hand with them on the phone because they you develop a relationship of trust and things like that. And we follow through, and that's kind of what we're trying to do. And instead of, I know a lot of places are like trying to go to all screens and have that type of communication, but the fact that we can take teams there of two, which is what we do, and we just meet them one-on-one and talk to them about their eye health is awesome, and it's preventative. So when we can see things before they even have to take that step to go to the big city, right? And we can catch things early and have those preventable conversations of like, hey, this is the path you're going, and this is what you need to pay attention to because this is what can happen. And then just developing that relationship. So that's kind of what we bring to the villages is like a continuation of care, that trust factor, one-on-one with our patients, and try to ease the burden of the travel for them.
Yeah, so after COVID, I did personally as a surgical specialty more telehealth, and I found it definitely useful, particularly for follow-ups, things like that. And what
Mhm.
you're referring to is that initial trust factor, which is huge for at least the initial visits for them to see. Yeah, so you can't just go all telehealth. I love the, mix, the hybrid approach of what you're doing. So it sounds like though right now, right, your group is already doing this. Is the goal then to expand the services so you're covering more territory and helping more people? Is that correct?
Yeah, so our biggest challenge, we're currently doing this. We have locations that we've been going to for 20 years, but there's a lot of villages in Alaska, and some are more rural than others. So our challenge a lot of times is the awareness is part of it. It's showing up to a village and having connections in each village so that we get the trust factor, so we can talk to people there more. Um, and it's the fact that some villages are so small, you go there and sometimes not everyone's aware of you being there or their connections aren't in place. And so you don't get a lot of people showing up. And then it makes this hard for us to go back there again because of the logistics and the cost to go to that place. So contracts with like logistics, just like more village contacts, things like that, make it easier for us because when we show up, we actually want to do what we do and not just go there and be like, oh, we're just hanging out, for a few days. And like you're like, why do we even come here? So it's
Right.
just I think the awareness of why eye care is important, the preventative measure of it, and just those contacts with the villages.
So speaking of like contacts, then what sort of partnerships do you feel like would be useful if you already have, or are those that you're looking to obtain to make this program successful?
Yeah. Really, like Native communities is big. We do have a few partnerships already with some throughout the state. But those are great too because when we get to just a contact person from that area to be like, we'd love to have you come here twice a year, and then we can plan that, and then they then can plan like people they have with diabetes in their community that we can follow up with, or even just children too. We see a lot of children in schools, and kids just if they can't see, it makes it difficult for them to like learn and experience the world. And so when we come in and we can give them that, it just makes everyone in the community's lives easier throughout their whole life, right? Because like if you can't see, it's hard to, do other things, right? So, yeah, so just like contacts in like schools, in like those tribal communities, um, yeah, and just to establish like a long-term relationship. We don't want to be like a one and done, be like, oh, we come, we see people, we leave. We really want something that's consistent and long-term partnership, just so that we can keep that continuation of care, which is better for everyone, for the villagers, and yeah, and for us too, so we can keep doing what we love to do.
No, that's perfect. Yeah, and that's one of the things that keeps coming up is you can have a great program, but if you don't have the correct connections within the tribal communities, there's that whole trust issue. And even though you have a service that's going to help them, for them to utilize those services, there has to be this partnership. So that's important. And so let's say you get the award. What are you going to use this money for? How are you going to make sure this program's successful?
The biggest thing for us, I think, is patient education. So, why get your eyes checked, right? And so another thing with Alaskans we found is they wait like 3 years, 4 years every time to get their eyes checked. Or I have patients coming in being like, I could see fine, but then I look and they have a bunch of diabetic retinopathy and they're like close to going blind because their blood sugars are like not controlled. So it's just that I think communication and education aspect that's huge. Um, yeah, marketing for that would be big throughout the villages, and then that in turn would help even tribal communities and even hospital systems understand the importance of what we do and how we can partner even with primary care providers with the diabetes aspect. Yeah, and just better serve Alaskans with their whole health because when we look into their eyes, it gives you a really big clue to what's happening in your whole body.
So I was just going to bring that up because I remember that in training, even as a student. Like, it's amazing how much pathology you pick up just by looking in the eyes at an earlier stage. And that's the most critical, is like you said, some of these patients are getting missed earlier when you could have a successful intervention. Yeah. So that's good. So, and if you don't get this funding, how is this going to impact then these communities?
Yeah, I mean, they'll just keep doing what they've always been doing, right?
Yeah.
The diabetes is huge in Alaska. So many people have that, and the more providers they see, because eye doctors were kind of easy and like to talk to, and like people aren't scared to go to the eye doctor like sometimes they are other doctors. Like they're like, oh, I'm gonna get my eyes checked. I get some cute new glasses, and they also don't understand the other side always to it. Like so we kind of come in sneakily being like, hey, like you do need glasses. This is how we can help you see better. But also, it's like that added little bit of education for the diabetes. Like you really need to follow up on this. And it's that whole piece. And so if we don't get this funding, I mean, we'll still keep going on with how we're doing, but it's slower and we just don't have it just won't be as scalable or as big to hit more communities, I would say. Or even those smaller ones that sometimes we go to and we don't get as many people coming out because they're just not aware of the reasons why to get your eyes checked. So yeah, so the funding would help with that. It would just help all Alaskans more throughout the state, kind of doing what we're doing where we can't really do it at the scale we'd like to, if that kind of makes sense.
Yeah, no, that's great. Hopefully everything works out. Let's say so somebody is in one of these organizations, these tribal communities, and they realize, yes, wow, my community could benefit. What is the best way for them to reach out for possible like partnerships?
Yeah, yeah, definitely. I mean, they can reach out to me. Email is a great way to reach out.
What's the best email for you? So they have
Yeah, it's A O'Dwyer, so Odwyer at iGuysAlaska.org. So that's
perfect.
spelled out EYE, guys,
Okay. Yeah.
Alaska.org.
We'll make sure we put some information on that. Excellent. Any other parting words?
I don't think so.
Yeah.
We just love what we do and we'd like the opportunity to just keep doing it.
Awesome. All right. Well, great talking with you. Okay. Hopefully everything works out.